know the city good there. Damn, I've been working you guys for 21 years. You know this everything. So there you go. Yeah, that's it.
¿No tenés papelito?
No.
No, no, no. No, here, let's see. Good.
Yeah, I'll take one. Usually before age. No, I always forget. Yeah. Well, at the very beginning, I found out that I was really, no, hold on. He didn't want to. He didn't want to go to the hospital because, you know, it's so bad. It was so bad back then. How are you?
How are you all?
Hi, man, how are you?
Good afternoon, everybody. Thank you so much for joining us this afternoon for this afternoon's press conference. Today we have Mayor Dean Margot joining us, as well as Dr. Hector Ocaranza, Public Health Director Ms. Angela Mora, as well as Assistant Fire Chief Jorge Rodriguez, Emergency Management Coordinator, and also Chief Commander Talamantes, Humberto Talamantes, and Mayor, I leave the floor to you.
Ready? Thank you all. I'm actually pretty hopeful today, and you may be asking why. Well, a lot of it has to do with our contact tracing that we've done in the last week. We did a breakdown, a deep dive breakdown of our contact tracing from November the 10th through the 16th, just 3 days ago. And what we discovered is that 55.11% of our positives were coming from shopping at large retailers. 14.86% was coming from restaurants. 13.04% was coming from travel to Mexico. 7.18% was coming from parties and reunions. 6.47% was gyms, and 3.34% was from large gatherings. We also found out that the age differential had changed for those that were the most positive was from ages 30 to 50. And that's a big change from the what we were looking at before. So greater than 50% of those positives were coming from ages 30 to 50. Now, why am I hopeful for that? Because that points out the areas that we need to address. And so we've talked to a lot of the big box retailers recently. We've talked to Walmart, Home Depot, Best Buy, Target. We're reaching out to the others. And each of those operations are considered essential under the CISA Homeland Security Guidelines, which limits our ability to control. But what we can do is request that they participate on their own to help limit occupancy at their respective locations. Walmart has already agreed to start doing what they term as metering, limiting the occupancy of their stores, which we're appreciative of. The really only thing we can do is, from an enforcement standpoint, and I'm not sure the public at large understands, we have a mask enforcement policy with penalties. The first time you're caught without a mask in the city of El Paso, it's a warning. The second time you're caught without a mask, it's $250. And each successive time you're not wearing a mask, it's $250. And I'm not sure the public at large fully understands that. So we do have a mask mandate within our city. Secondarily, we have a distancing limitation of 6 feet. So we can inspect those particular stores and hope that they're maintaining their distancing of at least 6 feet. The only other limitation they have is the occupancy of their physical structures. And so they are not limited to 50% like we limit all of our non-essential businesses under my orders thus far. But it's positive so that we know where we need to address. And we've talked about the fact over the last couple of weeks that it's imperative that we don't go out as families to go shopping, that we send a single designee for your family to shop. However, I've also said I understand with single parents that you're going to need to take your children with you, and that's understandable. But just limit it's indigenous to our nature. It's part of our culture to have family gatherings and go shopping. And we've just got to stop that. But that's the reason I'm hopeful is that we now know the areas we really, really, really need to target to try to stop this spread. On the vaccines, announcement this morning that Pfizer is going to be shooting for an immediate FDA approval. I want you to know that the city is prepared for vaccine distribution. We took the CARES Act money and bought 4 buildings to act as COVID clinics for health care and distribution of the vaccines. I won't go into the addresses, but we did that. We've talked about that. And we also have 3 other sites that the public health has now. So we'll have 7 sites for clinics and distribution of the vaccine. We will have at each location a freezer that goes to below 70 degrees Fahrenheit, which is the requirement we understand for the Pfizer vaccine. And we'll also have regular refrigerators, which are designed for the other types of vaccines. And there are 4. I understand there are supposed to be 4 vaccines, and the Johnson & Johnson and the Moderna ones are only require refrigeration, so we'll be well prepared. One other thing I left out is that as we look at those exposures of where our contact tracers are coming from or where our exposures are coming from with the contact tracing, we've also done more with TABC on the inspections related to the restaurant bar areas. And we've had 136 inspections conducted on Tuesday and Wednesday night. There were no violations found, including the previous 2 weeks. The total is 842 inspections, 6 warnings, and 2 administrative cases. We've tested almost 600,000 El Pasoans, and that is tremendous, and that gives us the data we need for determining under the contact tracing data where is the exposure coming from so we can deal with it. Hospital capacity is tight, but we have the capacity. The hospitals here, including our private hospitals along with UMC, have created over 550 rooms since this pandemic was started. We also have the alternate care site that has 100 beds, and right now there are 52 patients at our alternate care site. We have medically evacuated, as of yesterday, 84 patients to other spots in Texas. And we have, based on FEMA and the state of Texas, we have 1,562 medical personnel here in El Paso, doctors, nurses, respiratory therapists, technicians, all supporting us. There is no need for any concern related to rationing of health care. None whatsoever. We are in good stead, and we have plenty of supplies. We have plenty of PPE. I've spoken to both the hospitals, the private hospital CEOs today and yesterday. I get the updates daily from our public health department, and we are fine on our health care and supplies. Now, what I am concerned about is people failing to take care of themselves in other medical areas. I have the privilege of representing El Paso and serving on the Cancer Prevention and Research Institute of Texas. Oversight Committee. We had a meeting yesterday. We have given lots of prevention dollar grants to Texas Tech here under Dr. Shokar. And I asked, well, and these are for colorectal, cervical, and breast cancer screenings in our region. And so I said, well, how are we doing this year compared to last year? And if you look at the months March to May, a year ago, we did 978 colorectal cancer screenings. This year, we've only done 290 during that period. We did 556 diagnostic colorectal cancer reviews. This year, we've only done 14. My biggest concern, I'll just say, on cervical cancer screenings, we did 181 from March to May last year. We've done 32 this year. We did on breast cancer. We did 303 screenings a year ago, and we've done 42 now, this spring. I mean, we've got to maintain our health, and we can't let other things, because of this pandemic, dictate that. It is imperative. We've had too many deaths. We're an exceptionally vulnerable population. CNN did a report yesterday that came out yesterday that talked about Black, Latino, and Native Americans are hospitalized at 4 times the normal rate. And so we're very vulnerable, and we've got to be very careful. Mexico yesterday announced that they are extending their travel restrictions to non-essential until the 21st of December. I'm very much in supportive of that. And I assume we will too as well, but that's up to Homeland Security, and I have requested that we do that. With Thanksgiving forthcoming, one of the biggest concerns we have is the gatherings and the spread that come from family gatherings, which is kind of what we're all about here in our community as a multi-generational community. We've got to protect ourselves and our loved ones. And you know, El Paso, I remember after August 3rd, going to the blood bank and seeing people waiting for 11 hours to give blood, and the prayers that were offered throughout our community. We are a very caring community about each other. And we need to continue that as we go forward through this pandemic. Yes, a vaccine's coming. It'll only go to the healthcare workers and the most vulnerable initially, as I'm told. And we probably won't get it fully distributed, and Dr. Ocaranza may know more, but until, as I read the literature and the information, and probably until next summer, fully distributed. But so we've got to learn to live with this. And so how do we do that? We protect our families, we protect our loved ones, and we do what is right. And so we maintain the distancing, we wear the mask, and we wash our hands, and we avoid large gatherings. When you look, I've mentioned before, when we did a little deep dive with the Rio Grande Valley, which had the spikes just before us, and they had it for, they told Angela Mora, our public health director, that it took them somewhere between 4 and 5 weeks to hit their plateau. This is our 5th week. I don't know that we've hit it at all. I remain prayerfully optimistic, but I'm not sure yet. But the bottom line is this is a behavioral issue that can be controlled by our own individual actions, and we need to care about our family members and our fellow El Pasoans. So with that, I'll conclude until later if you have questions.
Thank you, Mayor. I'm going to ask Dr. Hector Ocaranza to join us at the podium. Thank you, Dr.
Good afternoon. Today, I might not be going through the dashboard because by now everybody should be familiarized with the dashboard. It is prudent to say that we still have a dire situation in El Paso. We still have quite a bit of people, quite a bit of loved ones being positive for the COVID-19. And as we see the positive cases, we see people ending up in the hospital. Our hospitals have done a great job for caring for all of our loved ones that needed that higher level of care. Unfortunately, many of us, or many of them, need a higher level of care because they have those pre-existing conditions that they haven't been able to take care of. They're afraid to go to the primary care provider or they cannot afford one so they can control their diabetes and their high blood pressure. They cannot afford their medication. And that's why we've been telling the community to make sure that they choose somebody to care for them. We need to give them the possibility of remain healthy. And that's the only way that we're going to be able to stay out of the hospital. Our healthcare workers are working tirelessly, and we've been receiving help from the state, the federal government, and for a lot of people that has been able to help us with donations, with many other supplies. And for all that, thank you to each and every one of you. For all those in the community that are following the recommendations to stay home, to wash your hands, to wear your mask, thank you as well. And unfortunately, we still see a large number of people passing away. We know that we have a lot of risk factors to develop a lot of complications and pass away. CDC has mentioned that we have over 4 times more likely to end up in the hospital. So we need to be extra vigilant. We need to be extra careful in how we take care of our loved ones, how we take care of ourselves, and how we're going to be staying healthy for these holidays and for many years to come. So I want to be talking a little bit more about Thanksgiving since it's upon us. And I strongly recommend that people do not do large gatherings. There's many ways that we can celebrate Thanksgiving, and we can do virtual potlucks. We can do also a lot of the cooking that we used to do and share. But we can leave it at the footsteps or the doorsteps of our loved ones, and we can still share those delicious dishes and share a lot of the love and just log in virtually so we can continue sharing that tradition and be thankful. And also, it is recommended, and I strongly advise each and every one of you that have tested positive, just remain home. Follow the isolation and quarantine recommendations. One of the best things that you can do, if somebody in the household comes back positive, a lot of people come and ask, well, what do I do? Well, continue wearing your mask at home. Open the windows, the doors. The weather is so nice that you need to ventilate the house. Continue doing the cleaning and disinfecting so this way you don't infect other people in your household. We have quite a bit of households that are infected by one coming to the household and then the rest of the people get infected, unfortunately. Or we get scared and we send one of the kids to another household, another one of the relatives, and they're exposing other people as well. So we need to be cognizant of that. We need to be very careful. We need to make sure that hopefully you don't travel, but if you travel, please come and get tested. Get tested before, come and get tested when you come back, and remain in isolation or quarantine. Isolation if it is positive, quarantine if you were exposed or awaiting the test result, but come and get tested. We still have plenty of testing available, and that's the only way that we're going to be able to know if you're positive, if you were exposed somewhere else. Please come and do it. For this holiday season, I strongly, strongly recommend that you don't gather on Black Friday. Please don't wait for those sales in the stores. You can do it electronically. You can support our local businesses. And for those local businesses, please do everything possible so people won't be gathering outside. Please check your employees. Continue doing those policies that we had established, and they're published in nipistrong.org. There is a book that we have published with all the recommendations in which we're going to be putting on the screen in just a little bit. But we need to be responsible in the way that we do things. We have been urging the community to send only one person to do the essential activities like grocery shopping. We can do the same when we need to do those holiday shopping. Do it electronically, send only one person, but don't go as a family to do all those. It is extremely dangerous to take your loved one in a walker, your loved one with a wheelchair and oxygen, to go do just the grocery shopping when you have somebody that can do it. Please, we need to be extremely careful and let's give him the gift of life. That's the best thing that we can do. If we keep him healthy, we're going to be keeping him with us for many, many more years to come. And here's in the screen, the El Paso playbook, where we show all the businesses how can we stay open responsibly and how we have done those recommendations that they need to follow depending on the line of business, so everybody will stay healthy. And with that, I thank you.
Thank you, Dr. Ocaranza. And now I'd like to ask Ms. Angela Mora, Director of Public Health, to join us at the podium.
Good afternoon, everyone. Thank you once again for being here. We really appreciate your presence. Laura, you're going to upload the slides, right? So we continue working very diligently on preparing for vaccine distribution with the Texas Department of State Health Services. We meet with them once a week. We also continue meeting with Pfizer Pharmaceutical. They are working with us as well to determine the capacity, just to figure out how many vaccines are coming to El Paso and when. Not a lot of things have changed. The distribution of the vaccine is going to still be in 3 phases. Again, the first phase is going to be for healthcare workers that are the most high risk and most likely also highly vulnerable populations like the elderly population. So we're concentrating on those. So we have, we're going to show you, I wanted to show you how we are mapping the local providers that have signed up to be vaccine dispensers. So we have 3 different charts. The first one is all of them are as of November the 11th. We had less number of locations enrolled as of last week. I just got the numbers for this week, and now we have a total of 139 providers locally who have enrolled. And they can be a provider that has several facilities, like the Public Health Department, we have 7 facilities. So we enroll them individually. UMC has several facilities. So it's not the number of providers, it's the number of facilities where the vaccine is going to be dispensed. So we have, you see all the number of providers. That's not include, again, the 139 is a smaller number, but you see how we are mapping week after week where those providers are at. If we go to the second slide, you see this, we're mapping by deprivation area, the areas that are in highest need of healthcare provision. You see the red are the ones with most deprived areas, and then the brown is consecutively is less deprived, but those are how we're mapping the deprivation areas so that we can make sure that all the areas in high need of vaccines or medical providers, that we are targeting them. And if there's a gap that we identify public health, if there's not enough medical providers that are going to provide the vaccine in highly deprived areas, then public health is going to serve as to fill the gap, and we're going to be serving as a safety net for those communities as well. We expect many more local providers to enroll. We are targeting now pharmacies. There's only a couple of locally owned pharmacies that have signed up. So we are getting a distribution list for us to target all the locally owned pharmacies so that they can assist us in the dispensing. The more providers we have dispensing the vaccine once we get it, especially during phase 2 and primarily phase 3, which is when we're going to have a lot of vaccines, then we are going to have, based on the number of providers that are enrolling, we should have a very large capacity. The third slide you can see is, if we can go to the third slide, Laura, this is by the type of provider as per the last November the 11th. So we see we have public health provider, we have several providers that we have to enter the type, but we have several that are private physicians that are signed up as well. We have medical practice, quite a few medical practice. We have some long-term care facilities that have enrolled, and then we have the majority of the hospitals have also enrolled to be vaccine providers. So we will continue to update you, and I'm going to try to show this map so that you can see, again, the distribution of the local providers who have signed up, and we'll keep you updated on that as well. So what we're doing right now is we're trying to, working with Pfizer, we're trying to determine the capacity that we're going to have to dispense vaccines in El Paso, we have estimated that it's going to take about 10 minutes to administer one vaccine to each individual. It's a little lengthier than the regular vaccines because of the different steps that we need to follow to apply this vaccine. So we estimate that one vaccinator can provide 6 vaccines per hour. So if you have a vaccinator who works 8 hours a day, then you can see how many vaccines that one vaccinator can do. So we're going to try to determine how many of the locations, how many vaccinators they're going to have so that we can do the math. And roughly right now, based on the number, if you do the math, 6 persons per hour per vaccinator. So if you had 5 vaccinators per clinic, then you know that you're going to have like 240 vaccines, individuals vaccinated a day. And then if we add all the 139, for example, that have signed up so far, that means that we're going to have a very large capacity for us to immunize the El Paso community. I'm happy to hear that we are probably ahead of the game, El Paso, compared to other Texas community, at least, communities. So we will continue to try to be ahead of the game in terms of the preparing for dispensing the vaccine in El Paso. Right now, all the locations for dispensing of the vaccines are going to be drive-through, but at a clinical setting. We are also discussing how we'll be able to safely move the vaccine through mobile units. The Department of Public Health, we have several units that we can use, that we use for other programs, like the WIC programs, for example. So we'll be able to deploy those mobile units to underserved communities so that we can also apply the vaccine there. So we are working with the pharmaceutical company, with Pfizer right now, to determine if that would be safe for us to transport the vaccine from one location in the containers they're giving us to safely dispense at open points of dispensing. So we also are, I think you heard, we issued a press release yesterday on a survey that we are conducting with the community. It's a bilingual English-Spanish survey. We're trying to determine the attitudes of the community in terms of getting the vaccine once we get it. So we have, it's a very simple survey. It's already posted on EP Strong, and there's maybe 7 different questions. And the main questions are you planning on getting the vaccine once it arrives in El Paso? And if they say no, and we want to know why is it that they are not considering taking it? Is it because of the safety issues? Is it because of they think it's going to cost because of potential side effects? So we're trying to determine more or less how many people will be interested, because that will help us further in our planning of this dispensing the vaccine once we get it. So we encourage the community to visit epstrong.org and to take the survey so they can tell us how they feel about the vaccine, and we hope that everybody is going to be responding very positively and that people are really going to take the vaccine. I know for one, I want you to see me taking the vaccine to hopefully serve as an example for the community. So we also are promoting antibody testing free of charge. Also, individuals can enroll at epstrong.org. And the reason that we are doing more antibody testing is because we want to determine, the degree of community spread in the community by testing individuals who might have been infected but never tested, maybe a lot of the asymptomatics. We want to target those individuals who've never tested but maybe think they were exposed. And we're going to be targeting zip codes where we've seen a high concentration of cases, and hopefully we will be able to determine a little more how much more community spread the community has suffered through these antibody tests that we are administering. So the test, individuals can enroll directly at epstrong.org, and it's a blood test. So they would have to make an appointment to go to, and everything can be done online except getting the blood drawn. It's going to be at LabQuest. LabQuest has about 10 different laboratories in the city, and the individuals interested in taking the antibody test, they can go to any of those facilities free of charge. and then they'll be able to pull the results directly from the LabQuest portal. So in a nutshell, that's all I have to share with you, and we'll wait for later, see if you have any questions. Thank you.
Thank you, Ms. Mora. I'd now like to invite Assistant Fire Chief Jorge Rodriguez, Emergency Management Coordinator, to the podium, please.
Good afternoon. So I'm going to be covering testing, some of the same highlights that the mayor covered on hospitals and then fatality management. So like the mayor mentioned, we are close to 600,000 tests that have been done in the community within the last, since we started. So that was back in March. To give you a little bit of context of the degree of testing and the resources we brought in to meet that current demand, we've done 200,000 tests, close to 200,000 tests in the last 4 weeks. So for perspective, it took us, we've done 600,000. That's from the beginning. In the last 4 weeks, we've done 200,000. So we've seen a slight increase from the previous week. Last week, we were at 47,381 tests administered. The previous week to that, we were at 53,000. So we've seen a slight decrease on demand. That is a indicator that shows us that the exposure concerns from the community might be slightly reduced, but it's still, the fact that we still have 47,000 people that are needing to get tested is still concerning. So, but there has been a slight demand on testing. We averaged 6,700 daily tests last week. That was our weekly average. And we just want to remind everybody, not only do we have the 9 state sites, the 4 city sites that can be done by appointment, all testing is for symptomatic and with and without symptoms. We have a list of over 50 locations that are available on epstrong.org. So if you do not want to access the state or city sites, you also have a long list of other locations that you can look at. So we urge the community to continue to go get tested. It gives us that ability to know how large the virus is within the community. So thank you for that. On hospitalizations, as the mayor mentioned, we have currently a census of 52 at the alternate care site at the convention center. We've done 84 air transportations out. Those are ongoing. The external medical staff, so that surge in staffing to not only maintain the current operations that hospitals have, but also to enhance the treatment and the medical requirements for those COVID patients. We're at 1,562, and we're still approving additional staffing requests that come in from the hospitals to the state. So that number will continue to increase. On fatality management, we continue to work with all the funeral homes, mortuaries, and the medical examiner, also with the Puerto Regional Advisory Council, to make sure that we're looking at the entire process from hospitalizations, deaths occurring at home, all the way down through the burial and cremation aspects of it. So we're ensuring that we have, that the process is moving smoothly, but it is unfortunate, just like we saw the spike in positive cases, and then the spike in hospitalizations. Now we're also going to see an increase in deaths. So with that, I'll turn it over to the next speaker. Thank you.
Thank you. I'm now going to invite Commander Humberto Talamantes from Police to give us an overview on enforcement. Commander.
Good afternoon, everyone. Once again, we would like to assure our public that our mitigation teams from the Department of Health, from TABC, from fire marshals and code are working closely, collaborating very closely to ensure that our businesses out there and our community in general are complying and adhering to all the directives and best practices and recommendations made by our health officials. We're also very pleased to inform the public that what our mitigation teams are encountering out there is that the majority of businesses and the public are being in compliance. Our inspections, our teams are witnessing firsthand that both employers and employees are genuinely trying to comply with all the directives. And we want to make sure that they have the most accurate and complete recommendations, guidelines from the city, the county, the state, so that we together can keep reducing the risk of this pandemic. We To give you an idea, during the last 2 weeks, our mitigations teams from November 6th to November 14th responded to 424 calls for service related to COVID complaints. There were 620 self-initiated compliance inspections. There were 80 citations issued and 30 warnings issued. We want to extend our gratitude to those businesses and the public that are doing their part to help protect their families, their neighbors, their friends. And we would also like to plead to the public, especially during this coming season, do your part. Every single one of you we need to do our part to ensure that we help protect our community, especially those nurses, those doctors that are in the front lines and putting themselves in risk every minute of the day. So please do your part and follow all the directives. If you need any information from the county and city directives, you can either visit epstrong.com or you can call the 311 service number. We also encourage you to report any non-compliant business to the 832-4400 non-emergency number. So thank you all very much and appreciate all your efforts.
Thank you, Commander. We'll now open it up to media inquiries. We remind media if you could please speak into the microphone.
I have one for, either the mayor or Talamantes. The mayor mentioned that there's a fine for not complying with wearing a mask. How many people have been cited for not wearing a mask?
Commander Talamantes, thank you.
Yes, as I mentioned, the statistics that I just provided were for the last 2 weekends from November 6th to the 14th. And the mask directive is the only one that you have to give a warning. It's one of the only directives that you have to give a warning to that person, that individual, before citing them. So that's why you see a lot of warnings being issued, because we got to make sure that our citizens are being treated fairly and also being educated of the mask mandate. And in addition to that, the masks, there is a lot of exceptions. Like I mentioned, if a citizen wants to make themselves aware of what the exceptions are or what the directive specifically entails, they can either visit ep.strong or call the 311 number. But the citations, go ahead, sir.
I wanted to follow up. How many of these warnings have you given them?
I don't want to give you inaccurate information because we started this since the beginning of March. And if you're asking specifically for citations, for mass citations, we can certainly obtain that for you, sir. Offhand, no, sir, but we can specifically give you that at a later time.
Alrighty, I've got a question for either Mayor Margot or Chief Rodriguez, just regarding testing.
Go ahead.
Okay, so we wanted to know about the lag in results. I know that we personally talked to a number of people who are still it's taking quite a bit of time to get their results back. So
Sure.
my question for you guys is, I mean, what more can you guys do to work with either, our city sites or our state sites to make sure that people are getting their results faster so that they're not going out and spreading the virus?
Correct. So we've been working very closely with the state, every individual case, and that's what really we ask the public is if they are having issues to report those to the Department of Public Health. That way we can address them and we can follow up on them. So we've been have been working very closely with the state. We're getting in, from what we can ascertain that there are some delays on certain labs. Not all the labs, but there are certain ones. On the city side, so those we have more local control, so that we expedite as quickly as possible. But again, we ask the public if they are having delays to give us that feedback, and then we'll address each individual case as it goes. But we are working on that. Thank you.
And if I could just follow up really quickly, I guess, what exactly are you guys doing to address these concerns? Because this is something that we've kind of been seeing for quite a while now.
So it varies. It varies because the results can either be because of entry that's inputted on the system. So it's usually those minor types of things, like wrong emails, It's usually those items. So we've been trying to address those and make sure not only with the staff, but anybody that, but also on the lab side, that all that is working efficiently. So, but no, thank you. That question.
Chief Rodriguez, this one's for you. So we've seen an uptick in cases at nursing homes just recently. How often is the mobile testing site testing people at nursing homes? Monthly, bi-monthly?
Right. So we have scheduled for them. We're testing them. If not every week, it's every other week. But it's based on the number of positive cases they have within their facility. So we have been working with them from the beginning. That's been one of our most critical areas. So we have teams that are constantly engaging with the funeral home. So it's really based on the funeral home's needs. But we've been testing usually every week.
Funeral homes or nursing homes?
Nursing homes.
Okay. One more follow-up question. With more positive cases coming, are you going to increase the number of times you're going to some of these testing sites?
Can you repeat
I'm
your
sorry.
question?
With the increase of positive cases at some of these nursing homes, are you going to increase the number of times you're now going?
Of course. Again, it's really driven by the situation within each individual nursing home. We have a team that is completely in communication with them on a daily basis. They're scheduling constantly. So yeah, they're going to test until they no longer have positive cases within their facility.
Okay, one more follow-up question. I don't know if it's for you or Dr. O possibly. What do you attribute these positive cases to? Is it people, employees who are going home and coming back? Is it new residents? Can you elaborate on that at all?
And the testing includes the staff as well. So yeah, we're covering all those.
Okay, but what can you attribute the increase in positive cases to? Can you elaborate on that at all? At nursing homes specifically?
Some of the positive cases at nursing home that you find on the staff might be because of the mobility that the staff has. When you test the residents and they don't move and they're still in the same facility, you're going to come a point that you're going to have everybody negative. And the staff is the one that really need to focus in testing on a regular basis, as Chief Rodriguez said. So those, because of the community spread that we're having, you want to find those and exclude them from coming to those nursing homes to continue working.
I have a question for Mayor Margot. Our esteemed Mayor Margot. You mentioned that in terms of hospital readiness, there are plenty of beds. However, your dashboard, when you go to El Paso Hospital status readiness, it says no. How do you explain that?
Well, we're hitting 90% probably of the capacity of those. And that's why we have the overflow, the tents, and everything else. What I'm saying is that we will adapt, and it changes every day. It changes from the morning to the afternoon. You'll see the number of people that leave the ICU or the ones that increase or leave. So it's a variable thing. The point is we're managing it, and the hospital systems together have, as they informed me the other day, collectively we've come up with 550 extra rooms in our city that we wouldn't have had otherwise, just adjusting to the needs for our community. So, we still have extra space at the alternate care site. It's unfortunate we have to have an alternate care site. And again, I also want to respond and say, if I fail to do so, we've got some real heroes working 12 hours a day who are at, they're tapped, they're at their end, and that's why we had 1,500 and some odd come in else from all over the state and the nation to help assist. So until we can hit that plateau, which again, I go back, everything points to our own human behavior as dictating how much spread we have. And until we can grasp that and understand also, even when the vaccine comes, we're still going to have to be wearing face coverings, maintaining distancing, and washing our hands. And I think, people have just got to understand, it isn't going away. This isn't going to be like spring break. It's not going away for a while. And we have to adjust our lifestyle and learn to live with it. And that's the only way to do it. But we're adjusting daily, so it changes every day. I get two sets of data. I get a morning, actually an evening data and an afternoon data.
So you have peaks and plateaus.
It goes like
valleys
this.
and,
Yeah, it goes like
in
that.
terms of the hospital readiness.
Every day. And I talked to the hospital CEOs yesterday and today. How are you doing? What do you need? Is there anything we can provide? Do I need to go to the state for anything? Do we need to go to FEMA for anything? What do we need to do? And I talk to them frequently about that. And they said, we're holding our own. We're actually down. One of them said, I actually have more space. This was midday today. So,
I want to change the topic now to the National Guard, and I know you have a direct line to Governor Abbott. Have you made a request for the National Guard to come in and help us all out?
our Emergency Operations Center is handling all of that, and it's part of their fatality management that they did. They're the ones that have reached out for support, and it's controlled that way. Yeah.
Yeah, if you don't mind. The question was, in terms of the National Guard, has there been a request for the National Guard to come in and help us all out?
Yes, so we have a tentative request that has been submitted to the state for the use of the Texas military. However, we have a state team that's doing an assessment currently on the ground, and based on that assessment, we'll hopefully have a decision on that. Thank you.
Mayor Margot, I have a question for you, please. So this question is revolving financial relief for small businesses. We've got
Right.
some of the staple restaurants here in El Paso who are not able to qualify or do not qualify for, federal dollars. I know that these are federal guidelines that are created to allow some of these businesses to receive this money, but there's so many who are falling within the cracks and, really suffering from that. How are you making it easier for them?
Well, we've done, we've increased some of our CARES Act funding. We've allocated it in different areas. We took some more money. Everything has to be distributed by the 31st of December. So we're going to make sure it's all out by the middle of December. And we weren't, some of the rental assistance wasn't going out fast enough, wasn't being requested fast enough. So we allocated some of those dollars to food security for our food pantry. We also took more dollars and put them into the Hispanic Chamber. We doubled what they had. I think they had 500,000 originally given for their grants, and we've upped that to $1 million. There's $2 million, I think, went to the chamber. Let's see if I've got the data here. We've given over 682 grants have been given to our local businesses, totaling $11 million in funding so far. Nearly $2 million is being utilized to retrofit businesses to mitigate the spread of COVID-19, and we're assisting approximately 100 businesses in that. And then you've got the businesses that have taken the pledge to safety and everything else. So I mean, believe me, I recognize what they're going through. As we've talked about, this pandemic affects families that have been impacted by the disease and those who've lost loved ones, and it's impacting those who are trying to put food on the table and pay their rent and buy their medicines. And so we're going to try to do the best we can. We also need more federal dollars. We need another CARES Act support, or PPP, or whatever you call it. We've all requested that. Most of my big city mayors and the rest of Texas, we've all together requested from our delegations, our federal delegations, more support.
Right. And so you've talked about the number, there's more money being kind of allocated that way, but what about the restrictions? If businesses can't qualify for it, they can't get the money.
Well, we talked about it, I think, at the last council meeting, where we're changing some of the criteria so to make it easier to get the money out, and more of it having for grants and other things. My understanding is that the last I heard was that was discussed, I think, at the last council meeting, and we said we were adjusting the criteria so we could get it out there where there wasn't any restriction, there wasn't near the limitations that were previously addressed.
What's changing in the criteria, if you don't mind me asking?
I don't have the specifics. The whole idea was to say, what's precluding you from receiving this that needs it, and so what can we do to help you get it? I mean, part of it's grants, part of it's loans, part of it's, but the majority of it, I think, is going as grants. So
Thank you, Mayor.
we're trying to do whatever we can.
I have one last question from online. The question is for Commander Talamantes, and then I'd like to switch over to Spanish. The question for Commander Talamantes is from Eleanor Dearman from the El Paso Times. Commander, what are the citations most frequently being used? How common are citations for family gatherings?
The family gatherings violations are the least of what we encounter of the non-compliant out there. The majority are face coverings, social gathering, or occupancy exceeding the limits of occupancy at bar restaurants. But the most common ones are face coverings and those, but cone gatherings are rare. We, for example, out of the 420-foot calls for service that I mentioned to you, 9 of them were at residential. So that gives you a comparison how minimal they are.
And her follow-up question, is the city still not offering exemptions for gatherings? Why or why not? And
No, the guidelines remain the same. If you're going to have gatherings, 10 or less, and those haven't changed.
correct. And yeah, I think that she's referencing the city's approval, the ones that the mayor provides. We are no longer offering exemptions.
Correct.
Okay. We're going to go ahead and switch over to the Spanish, and I'll ask. Sure. So,
So maybe this is for Director Mora. So we were just curious about contact tracing and when you guys officially consider a case not active anymore. And we're curious if our active cases are lower than what the dashboard reflects, if contact tracers haven't been able to get in contact with someone.
So a case is considered closed when we call the individual on day 10 after they go into isolation, because isolation is customarily 10 days. The individual is ill, it can go to 20 days or more. So once we talk to the individual and we identify that there's no symptomatology present anymore, then that individual is released. So I believe that the numbers question in terms of the active cases is that we are a little behind with Texas Health Trace documentation, but we are moving forward and we should be seeing an improvement in that area, probably no later than tomorrow, maybe if not by the end of the day. That's what was holding us the numbers a little higher than they should be. You're welcome.
and now I'll ask Dr. Ocaranza to provide the Spanish translation for his points.
Buenas tardes. Ahora vamos a hablar en español y darles una actualización en cuanto a la situación del COVID-19 en nuestra comunidad, en el cual ya hemos usado bastante nuestra tabla de datos y la gente puede seguir familiarizándose con nuestra tabla de datos que la encuentra en el sitio web epistrong.org. Y cabe mencionar de que seguimos viendo esos casos positivos, los cuales afortunadamente hemos visto un descenso en el número de casos a comparación de semanas anteriores, pero no por eso debemos darnos a suponer que estamos ganando la batalla. Todavía tenemos que seguir, bien importante, todas las indicaciones que hemos dado en el cual estamos reforzando que todo el mundo use su cubrebocas, reforzando de que todo el mundo observe la sana distancia y que siga las medidas de higiene que hemos recomendado con anterioridad. Seguimos viendo que nuestros familiares, amigos, conocidos, siguen necesitando la ayuda del personal que se encuentra en el hospital debido a condiciones que se han exacerbado, debido a que se han enfermado por el COVID-19 y empiezan a desarrollar síntomas más severos. Y desafortunadamente, conforme vemos que los hospitales siguen recibiendo este tipo de pacientes, vamos a ver que van a haber bastantes pacientes que van a fallecer debido a las complicaciones del COVID-19. Desafortunadamente, nuestra comunidad tiene muchos factores de riesgo, los cuales nos hacen mucho más vulnerables para desarrollar este tipo de complicaciones y fallecer a causa del COVID-19, pero no solamente del COVID, sino también de muchas otras infecciones y otros padecimientos que pueden dar como consecuencia complicaciones y fallecer debido a esto. Seguimos viendo un aumento muy considerable de funciones debido al COVID-19 y nuestros hospitales están saturados y aproximadamente la mitad de los pacientes que están tratados en los hospitales son de COVID-19. Tenemos la ayuda de personal que mandan por parte del Estado, por parte de la Federación, los cuales nos han ayudado a incrementar el número de camas, pero estamos en una situación grave lo cual toda la comunidad sabe la situación en la que estamos, y si no lo sabe, por favor, sigue las indicaciones porque tenemos ese problema y ese problema es grave y no queremos que cualquiera de nuestros familiares o cualquiera de nuestros seres queridos tenga que acabar en el hospital o fallecer por alguno de estos tipos de complicaciones. Sabemos que también estos factores de riesgo es las personas que no pueden atenderse, personas que no pueden ir a comprar su medicamento. Escojan a alguien de la familia que pueda proveer de estos medicamentos, de que pueda proveerlos de lo necesario para no complicar ese tipo de padecimientos. En cuanto al Día de Acción de Gracias, queremos hacerle ver a la comunidad que estamos recomendando muy estrictamente las medidas de protección para todos. El hecho de que no se junten varias familias. Hay el concepto de que si se junta entre familia va a ser mucho más seguro que juntarse con amigos o cualquier otra persona, lo cual no es cierto. Una persona de la familia que llegue a la casa nos puede infectar a todos. Entonces tenemos que tener mucho cuidado, tenemos que seguir las recomendaciones de aislamiento y de cuarentena, la cual si una persona de nuestra familia llega a salir positivo, que siga poniéndose el cubrebocas, abra las ventanas, abra las puertas, deje que la casa se ventile y eso también nos va a ayudar aparte de toda la limpieza que debe de tener en la casa. De esa manera no vamos a poder contagiar a todos los demás de nuestra casa. Lo que ha sucedido también muchas veces es de que ya cuando sabemos que hay alguien positivo, mandamos a los niños o mandamos a cualquier otro familiar a la casa de otro de los familiares, lo cual va a exponer muchas más familias y pueden ellas salir positivos también debido a esto. Podemos celebrar el Día de Acción de Gracias de una manera más sana, de una manera más para proteger a todos estos seres queridos que se encuentran vulnerables, de la cual podemos usar los medios virtuales que ya hemos recomendado. Pueden seguir haciendo sus guisos, pueden seguir haciendo sus platillos, los cuales los pueden distribuir y los pueden dejar en la puerta de la casa de los familiares y ya cuando sea la hora de la cena compartirlos por medio de la computadora. Podemos seguir haciendo eso y también, bien importante, es preferible que no viaje, pero si va a viajar, antes de viajar y después de que regrese, vaya y hágase la prueba. Tenga o no tenga síntomas, es la manera más segura que vamos a proteger a nuestra familia, vamos a proteger a los compañeros de trabajo y a todos los que queremos y que no queremos que se vayan a exponer al virus del COVID-19. Va a empezar la temporada de compras por todos los días festivos y por favor, no se aglomeren en las tiendas esperando las ofertas. Les estamos recomendando muy estrictamente que no lo hagan. Hay maneras que lo pueden hacer de manera virtual, no yendo a la tienda con toda la familia, con la tía, la abuelita, en el andador, en la silla de ruedas, con el oxígeno, porque ellos son los que se pueden contagiar y pueden sufrir de este tipo de complicaciones. Le estamos haciendo un llamado a todas las tiendas, a todos los dueños de negocios, el cual sigue las reglas que están establecidas en el documento que hemos publicado en epstrong.org, en el cual le da todas las reglas a seguir del distanciamiento social, de los chequeos que tiene que tener con sus empleados. Si alguno de sus empleados está enfermo, siente síntomas, no lo haga venir a trabajar. Si sabe que está positivo, no lo haga venir a trabajar antes del tiempo que puede estar, que puede salir del aislamiento. Ha habido ocasiones en las cuales los obligan a los empleados a seguir trabajando a pesar de que son positivos y eso puede dar lugar a que contagien a mucha más gente. Entonces, las recomendaciones son muy claras, las recomendaciones siguen siendo las mismas y la solución a todo el problema lo tenemos al alcance. Tenemos que tomarlo muy en serio y tenemos que hacerlo cada uno de nosotros de la manera más estricta para poder dar el regalo más importante a todos nuestros seres queridos, que es el regalo de la vida. Queremos que sigan celebrando estos días festivos con todos nuestros seres queridos, pero de una manera más sana. Muchas gracias.
Gracias, doctora. Ahora invito a la directora Ángela Mora que nos acompañe.
So you'll upload the maps. Thank you, Laura. Buenas tardes a todos. Seguimos trabajando en la preparación de la distribución de la vacuna contra el COVID. Estamos trabajando semanalmente, nos reunimos con el Departamento de Salud del Estado de Texas para planear la distribución aquí en El Paso. También nos estamos reuniendo semanalmente con la compañía farmacéutica Pfizer, que es una de las farmacéuticas que seguramente va a ser aprobada para la vacuna. Le vamos a enseñar unos mapas para que vean cómo estamos nosotros teniendo cuenta de todos los proveedores que se han inscrito para proveer la vacuna aquí en El Paso, a los residentes del Paso, a las personas que viven en El Paso. El primer mapa es el número que dimos de proveedores que se han inscrito hasta la semana pasada. Esta semana ya el número aumentó, tenemos 139 proveedores locales que se han inscrito para aplicar la vacuna a las personas en El Paso. Y ustedes ven aquí cómo están todos los puntitos rojos, verdes, perdón. Esos son los proveedores donde se van a proveer la vacuna. El mapa segundo, este es un mapa que indica las áreas de necesidad, las áreas que tienen más necesidad de servicios médicos en el Condado del Paso, en la ciudad del Condado del Paso. Entonces vemos aquí que, por ejemplo, los sitios más de privados de servicios médicos están indicados en rojo y ustedes ven que hay bastantes distribuidores de vacunas en esos sitios, y el café es también área que necesita más atención, donde tenemos que asegurarnos que están los proveedores de vacunas, y luego los colores más claros ya es el área donde hay menos necesidad de servicios médicos. Entonces nosotros estamos haciendo este mapa, actualizándolo semanalmente para nosotros, el Departamento de Salud Pública, para nosotros determinar dónde va a haber áreas que no están cubiertas por algunos proveedores locales, para que entonces nosotros así nos aseguremos de que vamos a cubrir esas áreas. Esperamos que muchos más proveedores se inscriban. Estamos ahorita mandando avisos, invitación a todas las compañías de farmacia, todas las farmacias locales para que se inscriban, porque nada más tenemos un par de farmacias locales que se han inscrito para ser proveedores de vacunas, así es que esperamos que el número de farmacias locales aumente en las próximas 2 o 3 semanas. El mapa tercero, ven ustedes aquí, estamos indicando el tipo de proveedores de salud que se han inscrito, y tenemos, por ejemplo, al Departamento de Salud Pública, que tenemos 7 clínicas hasta ahora. Tenemos un gran número de proveedores que son médicos particulares, tienen práctica particular, que van a ofrecer la vacuna. Tenemos algunos sitios donde se le da cuidado a las personas mayores de edad que se han inscrito, y tenemos la mayoría de los hospitales también ya se han inscrito para aplicar la vacuna. No ha cambiado mucho el plan en lo que se refiere a las fases en que nos van a hacer llegar la vacuna al Paso. La primera fase nuevamente va a ser primordialmente para los proveedores de salud que están a mucho más riesgo de contraer el COVID, y también se van a vacunar a personas que son altamente vulnerables, como personas mayores de edad. Y esas son las 2 poblaciones que vamos a cubrir en la primera fase, y luego la segunda y tercera fase ya van a haber mucho más vacunas. Entonces nosotros estamos tratando de calcular cuál es la capacidad del Paso para vacunar contra el COVID, y estimamos que por cada vacunador se puede vacunar a 6 personas por hora. Entonces, si esas personas trabajan 8 horas al día, si tienen 5 vacunadores en una clínica, entonces van a poder vacunar 240 personas, que es la capacidad que tenemos para cada de nuestra clínica del Departamento de Salud Pública. Entonces, basado en ese número de personas que se pueden ver por vacunador por hora, vamos a tratar de calcular cuánta capacidad tenemos con el número de proveedores que se han inscrito aquí en El Paso. Entonces, ahorita tenemos 139 inscritos. Eso quiere decir que vamos a tener gran capacidad para vacunar a un gran número de personas en El Paso, especialmente cuando venga la tercera fase, cuando vamos a tener vacuna que va a ser en una cantidad muy, muy amplia para vacunar a todo mundo que esté interesado. También estamos tratando de determinar la actitud de la comunidad sobre el ponerse la vacuna. Tenemos una encuesta que acabamos de subir a epstrong.org, epstrong.org. Esta encuesta hace unas cuantas preguntas que incluye saber si la persona está interesada en ponerse la vacuna, y si la respuesta es no, entonces queremos saber por qué contestó no, por qué no se piensa poner la vacuna, si es por temor a los efectos secundarios, o porque creen que les va a costar, que tienen que pagar algo por la vacuna. Entonces, eso nos va a ayudar a planear mucho mejor qué cantidad de personas y qué tanta capacidad tenemos para servir a las personas que se quieren poner la vacuna, y también para hacer campaña de promoción, para explicarles a las personas que no es riesgoso ponerse la vacuna, y así incrementar el número de personas que estén interesadas en ponerse la vacuna. Yo en lo personal, yo ya estoy súper lista para ponerme la vacuna y servir de ejemplo al resto de la comunidad, especialmente de mi generación, que nos consideran personas vulnerables, y a ponernos la vacuna, y ojalá que mucha gente responda favorablemente. También estamos ofreciendo pruebas gratuitas de anticuerpos. Esto es para nosotros determinar si hay otros individuos en la comunidad que han sido infectados, pero que nunca tuvieron síntomas, que nunca se hicieron la prueba, pero que sin embargo tienen los anticuerpos que desarrollaron para pelear el COVID. Y eso estamos ofreciéndolo también por medio de las inscripciones, por medio de epstrong.org. Es gratuita la prueba y se van a hacer por medio de una muestra de sangre. La persona que esté interesada en hacerse la prueba, entonces va a tener que ir a uno de los laboratorios de LabQuest, que tienen aproximadamente 10 en El Paso, y pueden ir a cualquiera de esos sitios. Nuevamente, la prueba de anticuerpos es gratuita para la comunidad. Y eso es todo lo que tengo que reportar. Gracias.
Gracias. Y ahora le preguntamos al comandante Talamantes que nos dé su información en español, por favor.
Buenas tardes. Les queremos asegurar al público que nuestros equipos que están asignados a combatir y enforzar las directivas y las órdenes de locales y del condado, seguimos colaborando con el Departamento de Salud, el Departamento de Bomberos y el Departamento de Code Compliance, para que asegurarnos que los negocios estén siguiendo las órdenes y directivos y que tengan la información adecuada de las recomendaciones y las guías para que tener a su público y a sus clientes seguros. Estamos muy contentos también de avisarle al público que durante las últimas 2 fines de semana del periodo de noviembre 6 a noviembre de 14, nuestros inspectores que han ido a los negocios, a la mayoría de todo tipo de negocios en la ciudad, estamos viendo que están tratando muy duro para asegurarse que estén siguiendo estas directivas. Y nos da mucho gusto y queremos comendar a esos negocios y al público que están siguiendo las órdenes que se han dado. Durante este periodo el equipo respondió a 424 llamadas de servicio, a 620 inspecciones, donde en estas inspecciones la mayoría de las 620 no hubo violaciones y se dieron 80 citatorios, se dieron 30 warnings. Y estamos viendo que los empleados y los que emplean están haciendo todo lo que pueden para tratar de que sigan las órdenes y tener a nuestro público seguro. Queremos nomás avisarle al público otra vez, extender nuestra gratitud a los negocios, a la comunidad que está respondiendo y tratando lo mejor para seguir estos directivos. Y queremos que todos hagan la parte para así protegernos a nuestros familias, nuestros amigos, nuestros vecinos y como comunidad combatir esta epidemia. Les damos muchas gracias y los queremos que por favor hablen al número 832-4400 si quieren reportar una queja o que hablen al 311 si tienen cualquier pregunta de los directivos de salud. Muchas gracias.
Gracias, comandante. Y por último, porque no tenemos a Enrique hoy por la traducción de el señor, el jefe Rodríguez, nomás quería darle la respuesta sobre lo que dijo el señor Rodríguez, Jorge, que más de 600,000 pruebas se han hecho desde el marzo y lo que hemos visto en las últimas 4 semanas es que más de 200,000 pruebas se han hecho en las últimas 4 semanas. Hemos visto una reducción de demanda en las pruebas, entonces pensamos que probablemente es por parte de que el público anda viendo una reducción de necesidad para la prueba y andan tomando en cuenta que necesitan quedarse en casa y ojalá que empiecen a poner atención a lo que andamos platicando sobre cada semana, cada día. En la última semana vimos más de 600 pruebas que se hicieron y seguimos urgiéndole a la gente que sí se puede hacer la prueba de los 9 sitios que tienen el estado, en los 4 sitios que tiene la ciudad, y no importa si tiene uno síntomas o no, si no tienen síntomas. En el centro de convenciones ahorita tenemos más de 50 personas en el centro allí y hemos visto 84 personas que se han ido, hemos llevado al aire a otras ciudades para darles atención médica. Y seguimos trabajando con Border Rack y el mortuario y también las funerarias para asistir a los negocios al servicio de los disidentes. Y con eso le abrimos. ¿Tenías una pregunta, Saúl?
I'd like to ask you, I know a lot of people are concerned, Senator Moore, about the cost of the vaccine.
Can you repeat the question?
Yes, I can repeat it. Many of the folks back home who are hearing that the vaccine will eventually be available are concerned about what the cost of the vaccine will be. What will be the cost?
The COVID vaccine, once it arrives in El Paso, is going to be absolutely free. It's going to be drive-through as well, so people are going to go through the testing site very quickly, fill out just a very quick form like we do with the flu immunization vaccine, but the vaccine is absolutely free.
And Ms. Mara, if you could say that in Spanish as well.
¿Qué dije?
Sobre el costo.
¿Qué dice que dijo? Sí. ¿Listo? Una vez que llegue la vacuna contra el COVID a la ciudad del Paso, las personas que se interesen en tomarlo no les va a costar absolutamente nada. La vacuna va a ser gratuita y va a ser muy fácil de aplicarse. Va a tardar aproximadamente 10 minutos y va a ser nada más yendo en su automóvil como lo estamos haciendo con la vacuna de la influenza. Pero nuevamente la vacuna de COVID va a ser totalmente gratuita para los centros de salud pública.
Gracias. Y con eso terminamos la prensa. Le damos las gracias a la prensa por haber venido a acompañarnos. That completes today's press conference. We thank everybody for joining us. Please be sure to wear your mask. Thank you.